Awesome music. Cue Faye.
Good evening and welcome to this conversation. You're watching live with Faye on YouTube. Thank you for joining us. Every evening at 8 o'clock, we have a conversation on what we believe is important going on in the country right now. We normally talk about news. Today, we're going to pick up an interesting conversation as an offshoot of that news. The All India Institute of Medical Sciences in New Delhi has published a study in the Asian Journal of Psychiatry. It says basically that there has been a small but significant increase in internet search volume for help-seeking keywords, which indicates, basically news reports are sending a nudge to vulnerable individuals to seek support. But it also says there's a huge surge in internet search volumes of keywords related to suicide. Now, there could be 2 or 3 reasons for this. One is copycats, and this is this is a result of Sushant Singh Rajput's death by suicide on the 14th of June, and it's a result of that. And there's something called copycat suicides where other people also consider the same thing. This could also be because of a surge in the number of job losses and unemployment, in students feeling the pressure of the fact that they're having to take exams that they aren't comfortable taking, whether it's the NEET or the GEE. In fact, I was having a conversation with Member of Parliament Derek O'Brien, who shared with me that in West Bengal, the attendance of students taking the NEET exam was apparently 25%, which means 75% of those students didn't make it, which that's a kind of stress that they're having to go, under. Besides, the number of students who are going to be graduating this year from graduating colleges, from engineering colleges, who MBAs, who might not get jobs because of the state of the economy, all of that stress might be leading to anxiety and depression and possible cases of suicide. There are reports of increased number of suicides among young people coming in from across the country. The NCRB data that came out for 2019, and this is data that we examine on an annual basis, it basically said that there's been a sharp increase in the number of people dying of suicide in India. The rate of suicide has risen by 0.2%, but that also means that on an average, there are 381 deaths by suicide every day in India. A large number of these are farmers and daily wage laborers as well. And we do know that the WHO has said that the pandemic and the lockdown will be followed by a mental health pandemic with a large number of people looking for help. Now, before you decide that, this is not news, I'm not interested in this, I'm going to turn away, I want to just remind you of one thing. Even if you feel together and strong and feel like you don't need help, this conversation is about the people around you. If you have young people in your life, children or siblings or cousins, people you care about, friends who might be going through something, it's really important for us to understand what the telltale signs might be, to understand also what sort of behavioral patterns we should be looking for in someone, in a young person who's near us, who might be going through something, and also to understand what we should be doing if we find out that someone around us is going through something. Now, at the bottom of your screen, in a new software that we're just trying to use today, because we wanted to be able to put this data at the bottom of the screen, you'll see there are phone numbers of NGOs and of helplines that you can call. If you are feeling distressed or anxious or depressed, please pick up the phone and call these numbers. These numbers are free. And if you need to get in touch with us as well, you can get in touch with me at fayedesosa@gmail.com if you are feeling distressed, and we will find a way to put you in touch with people in your city who can help you. Joining me on the conversation this evening, Dr. Harish Shetty, who is a noted and respected psychiatrist. Also, Dr. Anjali Chhabria, who's a psychiatrist and an author. Nelson joins us out of Bangalore. He is the founder of the Suicide Prevention of India Foundation, and they're actually working on getting more and more people qualified to help out. And Kaneez, Surka, who's a comedian and has also been very vocal about what people go through and how we should be available to help, joins us as well. Good evening to all of you, and thank you for joining us. It's a pleasure to have this conversation. If I may, like I always start with Dr. Harish Shetty. Dr. Shetty, from the numbers that we're looking at, from the data that we're looking at, it's obvious that what you've been warning us about for the last several months is now actually happening. For people who are watching at this point who are looking for telltale signs in our family members, what are those telltale signs? What should we be looking for in the people around us? Dr. Shetty, I think you're muted. We're going to try and
For all those, this accidental death and suicides in India 2019 has come just today. Well, what is very important is that there's a lot of change in the behavior of people, and changes may not be the same what you see in normal times. So we need to be more alert during COVID times and during times which are very special. And the certain things are, number one is the tone is very loud.
Okay, we will try.
The tone is very.
Yeah, we'll try and
Yeah.
fix that. We'll try and fix that. We're using a different software today, so my producer Arun is going to try and fix that. But let me take that question then to Dr. Chhabria. Dr. Chhabria, hopefully your audio is working fine. But could you tell
Right.
us, what patterns you have noticed, if you've noticed a change?
So, what has happened is that a lot of people are today feeling extremely low, they're feeling alone, and relationships have borne a lot of stress because of the troubled times. What we need to look for is the statements. Okay, people who are suicidal talk about ending their lives. They may not say that, okay, I'm going to go and kill myself today, but they say that, I'm fed up of living. What's the point of living? It's better if I die. They may show anger issues, mood issues, and of course behavior changes. So a lot of people anyway in the lockdown have lost their sleep, and their sleep cycles have reversed. But if we feel that people around us are sleeping through the entire day and staying up the entire night and are getting extremely irritable, are getting cranky, and if you just start talking to them, they just walk away. We need to take these signs extremely seriously, and not only of youngsters, but also of adults and also of elderly population.
Is there, Dr. Chhabria, a special risk with the elderly population as well right now?
Yes, yes. The elderly population is quite vulnerable, and a lot of them feel that they're anyway going to die with COVID. So a lot of them have become withdrawn. They are not interacting with people. Some of them are extremely paranoid about getting out of the house, and a lot of them are not even paying attention to their daily health. Their blood pressure, diabetes, and other disorders are worsening. So we need to pay special attention to them. And we do not think that, oh, elderly people don't kill themselves. Elderly are quite vulnerable to killing themselves too.
Dr. Shetty is back with us. Hopefully your audio is a little better right now. Dr. Shetty, you were telling us about the report that's come out today. Go ahead, please.
Uh, this is the accidental deaths and suicides in India report which came out today. And it shows a marginal increase in the suicides among unemployed and self-employed. Apart from that, what I would like to add to what Anjali beautifully said is that the signs are very different apart from the frank signs. And they are that if the person's tone is a little loud, it is weary, teary, bland, and irritable. Don't brush it aside. That's number one. Number two is somebody refuses to come out of their house. I am seeing a lot of young kids at between the ages of 14 to 16 talking about jumping. I saw a few corporate employees who also felt like harming themselves because they were not they were not used to working at home and taking care of the responsibilities in home as well as taking care of their. So what is happening is from frustration to suicide. The entire road has been shortened in terms of expression, and also the railways have shown that in Maharashtra, this was reported by a newspaper, that there were more suicides between March and August in 2020 than in 2019. I mean, these figures are the figures of railways. Apart from that, as Anjali said beautifully, that the elderly, those who have lost their jobs, those who have to do multitasking at home, and those who are very scared of the future. There are three fears, isn't it? Fear of illness, fear of the uncertainty, and fear of death. So there are the number of vulnerable people have increased manifold, and I would say unless we do something on an emergency scale, every state needs to have a mental health professional in the task force, and we need to have massive interventions across the community, not only professionals, to various sections of the population. And anybody who talks about suicide needs to be screened immediately. Do not brush it under the carpet. We are in difficult times.
That's really important. Dr. Shetty, you did say we have to have a task force, and there's a large increase in the number of vulnerable people right now. Do we have enough therapists, enough counselors, enough psychiatrists to be able to handle what is coming or what's already come?
Absolutely fantastic question. I think what is very important is mental health is too important to be left to mental health professionals alone. You remember this sentence we shared on some other platform, and we need to have a hierarchy of people who can handle stress, distress, disorder, and disease at different levels. We do not have them, but a lot of people who are paramedics, a lot of people who are wanting to work can be enrolled in this entire movement, because we cannot stop this movement for want of mental health professionals. So if there's a movement, it has to be a people-based movement. It cannot be a movement based on the planks of only mental health professionals. So if you ask me, if I were in the task force, I would trace all those who have lost their family members and screen them for mental health issues. I would trace every person who has been admitted and who has recovered, and find out if there are mental health issues around them. I would, as the Mumbai Police Commissioner has earmarked ward-wise activity for admissions, for quarantine, and for all other issues. Why can't we have a ward-wise activity for mental health professionals? There are enough mental health professionals who are willing to volunteer and do a lot of Zoom meetings across. Online meetings can be done in big groups in every ward. So we need to really screen those who have lost their lives in the families, those who have recovered in the families, warriors who have been working, the ward boys, the nurses, and the doctors, the cops, etc. And I have recommended to the Maharashtra government that the IS officers also should be screened for mental health issues. So this screening is not at all out of place. It can be done. It's not one-to-one. It can be done as a group. And debriefing is something we need to do as a group. Remember, mental health is too important to be left to mental health professionals alone. We need a large number of mental health soldiers or warriors, as Anjali also says all the time. And of course, Kainaz and others, they are extremely useful for us around this time. We cannot have stoic mental health professionals all the time.
Well, I just want to bring in Nelson.
Sorry.
Because I understand training these soldiers of mental health is what you're doing right now. Nelson, could you explain to us what this activity is and what you're doing?
Right. Thanks, Faye, for having me on the show. So the WHO says that suicide prevention is everyone's business. Suicidal individuals, 8 out of 10 of them will give you verbal, non-verbal, or written signs. Picking up these signs is the key to saving a life. And as Dr. Harish and Dr. Anjali had mentioned, we do not have the mental health personnel in the country or the infrastructure or the suicide crisis helplines to handle emotionally distressed or suicidal individuals. Therefore, community-based interventions, and the WHO in its first report in 2014, Preventing Suicide, a Global Imperatives, had laid down a number of recommendations, including community-based interventions. So we train laypersons, students, parents, mental health professionals, those in the front line, to be able to recognize signs of suicide, to be able to offer emotional support, to be able to build a connection with the person, persuade them, and refer them to a specialist if required. So suicidality. So how you have suicide. The stages go from ideation to planning to autopilot, and suicidality is a very short-lived crisis. And if anybody would be able to offer emotional support at that point in time, we would be able to reduce the rate of suicide. So suicidality is a very short-lived crisis, and if somebody, anybody would be able to offer emotional support at that point in time, we would be able to reduce the rate of suicide. So then the person is in a position to actually be safe. So data suggests that among suicide survivors, 9 out of 10 suicide survivors will not go on to die by suicide. 7 out of 10 suicide survivors will not make a second attempt. So what this clearly states, and this is even in serious cases of those who would have used very lethal means to perhaps make an attempt, even they will, 9 out of 10. So 90% are not going to die because, they made the attempt, but they won't, right? So I just want to point out to the latest NCRB data. There's been a marginal increase from last year's. So there's 10,159 suicides by students in 2018. The 2019 report says 10,335. That's marginal increase. But if you look at it over a 5-year period, 99 to 2003, there were 27,990 suicides for students. Cut to 2014, 2018, this is almost doubled to 46,544. Now, these signs have been there for a long time, and you can go back to 10 or even 20 years. So in 2004, there was a report in the Lancet which suddenly looked at a small place in Tamil Nadu and Vellore, became the teen suicide capital of the world. Why? Because they went from home to home using a method called verbal autopsy to look at the deaths among young people, and found out what these deaths were caused by. And suddenly, Tamil Nadu, Vellore and Tamil Nadu emerged as the teen suicide capital of the world. We are waking up to these facts for a long time, except that we haven't taken it seriously enough to have a suicide prevention policy or a suicide prevention strategy, which will then percolate down to various stakeholders, and we know what we need to do. And it's very clear that if you have a strategy, that you over a period of time, you can actually reduce suicide. So Finland, China, Sri Lanka have all reduced suicides by 50 to 70% over a period of anything from 10 to 15 years. If we start now, we may be able to meet our SDG goal as well, because we've signed it, and suicide is one of the health indicators, and none of the states in India are going to meet the SDG target of 2030. So as Dr. Harish mentioned,
yeah. Work that you are doing, Nelson. I just want to read out a couple of comments that are coming in from our viewers. Gaurav Arora says, mental health is not covered under medical insurance despite an act being passed in 2017, which is the Mental Health Care Act of 2017. Therapy isn't affordable for many people. So many people asking, about the cost. Anisha Roy also saying, is it going to be expensive? And that's a concern. Given also, I think there's a link here with the fact that a lot of the stress and anxiety is linked with finances or loss of jobs or stress of running the home. The idea that therapy might be expensive would weigh very heavily. Animesh Yadav says, how do we counter the stigma of society regarding mental health, where seeking help from a psychiatrist is considered equal to being in a mental asylum? There is another question that's coming from Ipsa Rao, who says, will there be confidentiality of sharing that, sharing whatever we do share? And we'll take these piece by piece. I want to go to Kaneez. Kaneez, Dr. Shetty sort of suggested that influencers, people like yourself, who have a lot of young people follow you, take what you say seriously. There is an opportunity here to also be an advocate or to be, a mental health soldier. Give me your experience of what you're hearing from people around you, what kind of anxiety people are going through, and how someone like you could help.
So, I mean, yes, like there's, we get messages all the time from our followers saying that they're going through mental distress or a bout of depression, or they're in full depression. And it's very jarring for me to sometimes read it, because I'm not qualified to engage with this person. I don't want to guide them or misguide them. I don't want to give them wrong information. The best I can do is just maybe give them a list of mental health volunteers or therapists, which we do. So yeah, I know I also struggle with that, because I read it and I'm just like, I don't know what, and especially I don't want to misguide them, because that's a huge risk that I'm taking if I don't know what I'm up to. And I just listened to Nelson, and he was talking about training people in the front line, and I was like, it might be a good idea to maybe do something with influencers to be able to handle this when it comes up on our social media. So I was just while I was listening, I was like, that actually might be a really good idea to maybe do a workshop with a whole bunch of influencers to kind of how, because we all struggle. We're all kind of trying to figure out how to deal with individual people who approach us. Other than that, we do post generic posts about mental health and sometimes what we go through. We're very happy to share the stuff that we go through. But when it comes to individual cases, I definitely feel a little bit stuck.
Would you be comfortable sharing what you've been going through during this lockdown?
Of course. I mean, I've struggled with bouts of depression, and even when these experts are talking about, I've contemplated suicide. I have throughout my life, from when I was a teenager. There's been moments where I have contemplated that, and I think the biggest thing for me has always been like, I don't know who to talk to in the front line without freaking anybody out, because it's not like I necessarily want to take that step then, but I feel like if I mention suicide or death, everyone just freaks out. Even like now, I'm feeling a bit uncomfortable with everyone just being like, Kaneez, are you okay? I'm fine. But is there any place I can just talk about what I'm feeling? Maybe just go through the information in my head, because it might just be a case of anxiety or pent up frustration. And just at a base level, I'm not talking about going to therapy, which is what I've been doing for the last 4 years. But even before that, is there any place I can go to just vocalize what I'm feeling and why I'm feeling it, and just maybe get it out of my system without anybody freaking out? And that's kind of what I've...
Yeah, so basically, and somebody else brought this up, and I'm just going to read out this. Anand says, in the absence of a therapist, what can one do as a friend for someone who's struggling? Is there a psychological first aid kit? So I think that basically what Kaneez is talking about also is the ability to go to the nurse's office and just get checked out, for a temperature and not have to go to a surgeon. So are there layers of help that we can seek? And can more of us, do workshops and get ourselves in a position where we can help more people? Let me first, take these questions one by one. Dr. Anjali Chhabria, first question to you is about cost, because so many people are asking about the cost. Is therapy expensive? If we can't afford it, what do we do?
So first of all, let me educate people. This is a very common question, because people think that therapists are expensive and therapy is expensive. But actually, today all government hospitals, all municipal hospitals have a full-fledged psychiatry department. There are counselors working with them. There are psychologists working with them. And that is where we have all trained. And there the costs are absolutely zero. Okay. And for those, the other day someone was saying, oh, you're very expensive. And I just told them, I said, my hairdresser and I charge the same fees. So I don't think I'm so expensive. But the thing is, the perception is that therapy is expensive. The other thing I would like to also say here is that all doctors, I think they do a lot of charity, 1/3 of all our work that we do. So nobody leaves our offices because of lack of funds, So I think people need to go to whoever they are comfortable. And today we have a lot of online psychologists, online sessions which are available, which are not expensive. So I think people need to look for that, and also people need to discuss the cost as soon as they call a psychiatrist or a psychologist office and say that, okay, this is how much will it cost me? And if you want to do it absolutely free of cost, there are so many helplines there who are willing to talk to you absolutely free of cost.
In fact, at the bottom of your screen, there is a scroll that's tickering that has free helpline numbers that you can get in touch with. You can talk to someone on the phone. It's obviously confidential because that's part of the job, and it's free. Also, if you want, more help, take a look at Empower. M for Mumbai, Power. Look at their website. They run free helplines and clinics as well. All qualified people on the other side of the phone line. You can just pick up the phone and have a conversation with. So, for example, what Kaneez was talking about, if you're just feeling stressed, you want to have a conversation just to be able to process what you're feeling. Then that would be a good place to start, because that person will then tell you if you need to go see a counselor, a therapist, a psychiatrist, that basic diagnosis of where you are and what's going on. Dr. Shetty, there are a lot of questions being asked about confidentiality. Unfortunately, the Sushant Singh Rajput case would have drawn up a lot of doubts about confidentiality again, because now people are saying, if people around me find out, There is a stigma attached to it. There's all of this, bad behavior by the media, guys. The media right now, specifically television media, is behaving it's rotten. It's terrible, rotten behavior. There is no excuse for this behavior. And do not take your cues. Stop watching television. If we are actually on a mental health conversation, the first thing we should say is stop watching television news, switch it off. Nothing will happen if you don't know the latest moves on this case. You will live. We will all live, and arguably better off than if you were watching this. But Dr. Shetty, confidentiality. If I go on a lines, if I go to a shrink, a therapist, a counselor, can I be assured of confidentiality?
Of course, I think, firstly, I'll just add to the insurance thing which he asked. Well, insurance guys have been told by the Mental Health Care Act and the IRDA to give insurance when you are admitted. What happens is they will first say no. You have to escalate it, fight it hard. And I get insurance for all my patients who have been admitted under me. Let me say, you have to escalate. They'll ask you a few questions. You have to fight it hard. You have to go to the top, and then they really approve the insurance. That's number one. Number two, just before I answer your question, give me 10 seconds. 60% of Indians who harm themselves in this last report which came today have had education from primary level, middle level, and matriculation, which means our interventions have to go more to those who are being not educated. That I think is very, very important. Very, very important. And if you add the 12th standard guys, 74% of those who harm themselves and lose their lives are under 12 standards. So that is something which is very important. Number two is last year it was 1 out of 5 with respect to daily wage laborers. Now it is increasing. So daily wage laborers, elevating poverty is also a very important task. 1 out of 3 causes for ending their lives now in the latest report are family issues, and 1 out of 5 to 1 out of 6 are housewives, and also 1 out of 6 people who end their life by suicide are ill, physically ill. So these are the populations. Confidentiality is a very big issue. Most of the times there is no issue at all. I have not seen any violation of confidentiality in large number of cases. But what happens is the police and the media are in hand in glove, and there are a lot of leaks happening from the investigative agencies, which I think is very shameful. And most of the media are not following the WHO guidelines of reporting about mental health issues, and I think that's an issue. But with mental health professionals, we can be assured that confidentiality will be provided. In fact, people who come to me from my family members, other family members don't know whether they are with me or not. So that I think is very important, and we need to be very careful. There has been an occasional aberration, but I would say the aberration has been very, very occasional.
That's actually really well said. There's another question about suicidal, non-suicidal self-harm, and I'll come to that. Dipanshu Bhaskar says, a little bit of words that are left unsaid. This is really good work. Thank you, Dipanshu. Just reading out a couple of other comments. Tanvi D, I think we need a massive mental health awareness campaign across all age groups. Of late, there are celebrities on Twitter dissing mental health. I can see that many young people are agreeing, and that is scary. You're absolutely right. I agree with you. Questions of, but this person smiling in this photograph can't possibly be depressed. It is actually undoing years and years of work. It's really, really worrying. Hyperbole says, I don't feel like spreading yarn. I just want to appreciate your work. Thank you. Shamita Dasgupta, great conversation. In the US, hotlines have been created by each state to talk to folks that might be suffering from anxiety, suicidal thoughts, etc. That should be a consideration in India. Atish says, do pets improve mental health? And that's a question I will take to the panel. But Nelson, I want to come back to what Kaneez asked. Is it possible for people like Kaneez, who are popular and cool and who have a lot of people writing to them on Instagram saying, I'm going through something and I don't know what to do, can we institute a training program or a workshop to better equip people like Kaneez, who are well-meaning, to be able to offer help?
Absolutely, and I'm glad Kaneez asked. We did a workshop recently, which was initiated by some influencers, someone who also acts in a Ekta Kapoor serial. And this was a suicide prevention gatekeeper training. And the training online, which as a webinar is 2 hours, you can also do this online for an hour. So the gatekeeper training equips you to handle an emotionally distressed or a suicidal person, to be able to listen, without judgment, and to be able to offer them the support and persuade them so that they can then get help, right? So yes, instituting a training for influencers like Kaneez will go a long way, because they are then can amplify this to the rest of them, and we need more voices. So we recently did a training, we're going to do another training. So I think that's a great idea.
Yeah.
Nelson, if someone wants to get trained in this gatekeeper training, how do they get in touch? What should they do? And how much time does this take on an average?
Yeah, so the online training is 60 minutes, which is, can be done anytime on any device, and it doesn't have to be finished in a single setting. So they can go to our website, which is www.spif.in, and the training details are there. There's, of course, a 2-hour webinar, which is conducted, with instructors, and that can be customized as per requirement for students, for mental health professionals, for those in the front line, parents, and so on.
Yes,
I would like to
very
add
well.
here, Faye,
Please, go ahead.
three levels of training can be given instantly. One is, September is the suicide prevention month, and even if Kainaz and others who have 25 lakh followers and 20, I mean fantastic guys, even if they share the myths about suicide, the myths, that's also a big. I mean, we have a session only to shatter the myths, as
Yes.
Nelson said beautifully. And second is what to do when somebody comes and tells you, "I want to end my life." And the third most important thing is how to see that you help the person access a professional, because the gap between somebody being ill and somebody accessing it can be too long. And how to be there for the person till they access, and how to follow them up till the time that they are well. I mean, they are not doing the treatment, but the professionals doing the three things which happen is that a lot of people oppose the entire treatment. So how will a mental health soldier actually work around them? Number two is, how do you convince the person who's taking the treatment for not paying attention to the myths? And the third most important thing is, see to it that the conversation is not only about dying, the conversation is also about life. And these are the
Yes.
three modules
Absolutely.
we actually give free of cost to anybody who wants it.
Very well said. Dr.
Free of
Chhabria,
cost, free of cost.
there's another question saying, do we have good courses in psychology taught and textbooks available in all Indian languages? This is Bukisam Kiran who's asked this question. If you want to just tackle that. And another question from Ganapati Nathan Pillai, who has said, how do we ensure people in rural areas, people with low income backgrounds, oppressed communities also have access to mental health treatment? So here's the thing. It has become, mental health has become like an English-speaking sort of, you are in a certain strata of society. I even remember one person saying, because bhook pyas nahi hai, this generation, because you're not fighting to survive and put food on the table, that's why you've come up with these new problems. हमारे ज़माने में ये problems होते नहीं थे. We were worried about just surviving. So this is actually really detrimental, because if the numbers being shared on the panel tell us that daily wage laborers, farmers are committing suicide, it's, there is a class divide that says that, oh, they must be committing suicide out of desperation. Whereas in this side of this thing, it happens because of mental health issues. How do we bridge
Right.
that?
No, so I think what Dr. Shetty started with, we need a mental health movement in India, okay, which cuts across classes and which cuts across age groups. We need to reach out to all these people. Of course, there are books available, there are courses available, but we need to make it available. And the simplest thing is we need to work around the myths. Because what happens is, as Kaneez was saying, if you say, I'm suicidal, all your friends will run away. Nobody wants to talk to you, or they want to push you on to someone else. And of course, the conversations which are happening today, it's
Yes.
it's infuriating, it is insulting to mental health, it's insulting to psychiatry, the conversations that we hear all along social media. So I'm very glad that today we are having a balanced show over here, where we are actually discussing solutions, and we need to work at all different levels. And yes, if we could work with COVID, why can't we work with this? In fact, the mental health complications.
I just want to ask you an extended question to what you just said, and I'll ask Kaneez to also come weigh in on this. Given what is happening with the Sushant Singh Rajput case and what can only be described as a very malicious sort of media trial that the media is running against this one individual, Rhea Chakraborty, against there's still no evidence really. And no investigation is complete, but it's rabid. It's like a pack of animals at this point to be they're chasing after her. My concern here, Dr. Chhabria, is that it will cause people to be afraid of the suicide.
Yes.
If I find out that someone is in distress, people are going to be worried, yaar, अगली बार तो पुलिस तो मेरे पास पीछे आ जाएगी, तो मीडिया मेरे पीछे पहुंच जाएगी. I don't want to be
Yes.
involved in this police court के चक्कर में किसको पढ़ना है? You will say,
Absolutely.
भाई आप किसी और के पास जाओ. I can't be involved in this. I don't want to text you. I don't want a WhatsApp message trail. I don't want my phone calls. I don't want to leave any sort of trail of this conversation. I mean, imagine the kind of detrimental effect this is happening right now. And I want, first Dr. Chhabria and then Kaneez to sort of weigh in on this.
Absolutely. I think psychiatry has gone back 50 years because of what has happened in the last 2.5 months. Okay, we don't even know suicide, murder, whatever it was. The way this entire trial has gone on, I think people are going to forget the friends. I think the doctors are going to run away because the way people have been maligned in this entire case. So we need to get the conversations back. We need to have the right kind of conversations. And yes, of course, if someone is suicidal, what we tell people is to have a group of people looking after this person. So Kaneez wanted to say something.
No, I think that's my biggest fear is me talking to my friends on WhatsApp. And my fear is that if tomorrow something does happen, they are going to be taken through, dragged through, I don't know what. Like I'm scared for my friends to have conversations about anything because they will get dragged through what people in Sushant's lives are getting dragged through. And like, that's one of my biggest fears is like, I mean, Jesse, something happens and I become national news. Not that I'm important, but like, maybe the government needs a distraction and I become national news. But like, I am worried that my loved ones will be put through hell. So like, that's why, I mean, for me, at least personally, I try to have conversations in person because I don't try to hide evidence. I don't know what I'm trying to do, but I can't have conversations over text and even calls. I have to meet people in person, which is hot.
Which in a lockdown is really difficult to do.
It's difficult to do.
Yeah. Dr. Shetty?
So,
Yeah, I think I would not say that psychiatry has gone 50 years back, though Anjali is very upset like me. But I would say that don't worry, mental health professionals like me, Anjali and others are going to address this issue very positively, very effectively so that the cycle of viciousness will not happen in the future. That is number one. Number two, it's extremely important for everybody to understand. I said that in your show, I'll repeat this again. 1 out of 7 people are mentally ill, not 1 out of 8, 1 out of 7. And which means, Faye, in your family, my family, family of Nelson, family of Kaneez, family of Anjali, there's somebody there. And if you spread the cycle of viciousness, it's going to affect your own family. You are shooting the gun on your own head. And that is something people forget. But let me assure you on behalf of the mental health profession, we are not going to stop at that. We are quiet because there's eloquence in silence. And we assure you on this show that we're going to come back very strongly to establish norms of media reporting. I am going to say this on the show very openly. We will not allow this to happen.
Absolutely. We should not allow this to happen. All of us, and this is a really strong point that Dr. Shetty has made. If 1 in every 7 people is suffering, then that person is in your house. And we should treat every vulnerable person like a family member. Consider this. There's a young person in your house right now, brooding over their phone, with their phone in front of their faces all the time, and you write it down to teenage hormones and bad behavior. And if you don't catch the signs, if you're not paying attention, it might be too late. I mean, how can we be willing to take that risk? How can we be willing to take that risk? Switch off the television. For the sake of your own family members, switch it off. It is not that exciting. It is certainly not true. And it is despicable what you're watching, and you're putting your family members at risk. do anyone on the panel wants to answer the question of do pets help relieve stress to vulnerable people? Anyone who wants to pop in and answer?
Sure.
There is, yeah, Anjali, go ahead. Go ahead.
Yeah. No, of course, pets give you a lot of unconditional love, and stroking a pet itself increases oxytocin levels. So I think whoever can have pets, whether you can house pets, whether you want to foster pets, whether you want to feed pets on the road, please go ahead, because it will help you feel good, and that itself is good for you.
After
I mean,
Kainaz
there is
wanted to
one
say
little
something.
No,
brown
I'm just,
Indian. Yes. Go ahead.
I was just
Dr.
laughing
Shetty.
because she said pets give you unconditional love. I was like, have you met my cats? There is no unconditional love. But I agree the levels of oxytocin do increase, which make you feel, they make you feel
Dr. Shetty?
Yeah,
Pets.
animal assisted therapy is a science beyond stroking pets, but it's only for those who are comfortable with pets. That is very important. Some are not comfortable. You can't push a pet on a person. Number two, say you're from Bangalore, and in my house in
Yeah.
Bangalore, we have dogs, cats, and cows. And when I go to Bangalore, I get into the stable. I stroke the mane of the dog, but I also stroke the mane of a cow, and it's so beautiful. So I think
Yeah.
it's beautiful. The cat is on my lap, the dog is on my side, and the cow is in the stable. All three animals help me to feel good and feel better.
So obviously, if you have a pet, that's great. If you don't, and you're not afraid, and it is, and the little brown Indie Ramu in front of your building has been vaccinated, which is really important, then please feed him something and pet him, and he will reward you with unconditional love. Nelson, a question from Suraj, who says, what are your thoughts on the emergence of therapy apps on smartphones? In the US, there are reports that apps like BetterHelp are selling data to Facebook so they can sell ads to users. So, is this something that you recommend? Because obviously, the way things are going, this is the route that people are going to start sharing their information with these apps, like how we have weight loss apps. We'll also have
Right.
therapy apps. Is that something you recommend?
Right. Before I answer the question, I had a quick point on helping friends and being scared about it. So I think the same thing happened with road accidents. And then you had the
Yes.
Good Samaritan law. We need something similar, which will then protect individuals as long as they're following protocols and they can help people. And I think this needs to come into place and made into a law so people can freely and, without being scared of helping others, be protected. About apps, I do think that in a country like India, where we don't have enough, mental health professionals, we have only about 50 odd government-funded or government-owned hospitals, and we have about maybe 40 to 50 suicide crisis helplines. Only about 5 to 8 of them are 24/7, 365 days of the year, and suicidality peaks between 12 and 4 a.m. And most of these suicide crisis helplines may not be available. So apps definitely help in many ways. One is to understand your own mental health and maybe keep a track of it and your triggers and so on, as well as maybe even having an SOS where you could reach out to a friend or a therapist, or making a crisis and safety plan for yourself, which is very important. Also, think about this now. There has been a flurry of crisis helplines which have come out, including from NIMHANS, Let's Talk, COVID Response. Almost
Yes.
every state government has come out with helplines, but I'm hearing that the call volumes have actually dropped. This could be perhaps because in a country like India, how would you, where there's no privacy, can you pick up the phone and start talking when you have about 5 odd people in the house? Maybe you cannot. And for a lot of, and if you're talking about young people, they prefer to text versus pick up the phone and call. So in the US, there's something called the crisistextline.org, and it's become very popular because it's a text-based service, and it's basically run by volunteers who are trained for about 30 to 40 hours, and they provide emotional support. And it also works with artificial intelligence and machine learning. So what happens is, based on the message you send, it will recognize whether you're you've already self-harmed, or you're at an advanced stage of of suicide, and pushes you up the queue. And volunteers then use these cues to respond, and it's become very popular. So I would think that apps are helpful, and however, it may not work for everyone. There is the face-to-face of meeting with your psychiatrist or your therapist. There's nothing that can replace. Although now, because of the lockdown and COVID, telemedicine is something that we need to focus on. Apps are helpful. It needs to be part of a larger response, depending on the person as well as the condition that they have.
Absolutely, and especially given the challenge that India is looking at, which is the number of possibly vulnerable people who are going to need help, who are going to need diagnosing and sorting of how severe your problem is or how in desperate need of help you are. An app might be able to, just through a questionnaire, be able to sort through the number of calls that are coming in. Ipsa Rao says, is depression only an event-led? Is it a possibility that it could be genetic or hereditary? That's one question. Vidushi Bhatia, in a world, especially during Corona, loneliness seems to be on a rise. How do we differentiate loneliness from other conditions? Is there a different first aid kit that a person might be withdrawing and not asking for help? This is a great question. Dr. Shetty, I'll come to you with this. The first point is it genetic and hereditary? Secondly, how do we tell when someone is just lonely and, is an introvert, so we reaching out or calling out for help?
Yeah. Number one is that first was the question, I forget.
Hereditary. Is it?
Yeah. Number one is that when we did psychiatry, me and Anjali in the same hospital, a large part of our work was based on hereditary factors of depression, suicide, etc. Now it's gone all over. So the brain has not changed its size, shape, color, texture, and chemistry, but depression has increased, which means what? Environment has changed and the brain is not able to cope. The mind is not able to cope. So the increase in numbers is not only because of genetics, because of all other reasons. But if you have a family history of depression, you have to be careful if you have had an episode of depression. If you had a past history of depression, you have to be very careful if you had an episode of depression. If you had a family history of suicide, you have to be very careful when you only have depression. You need more attention and you need to be alert. That's number one. The second is when you're lonely, introverted or not. Introverted guys are introverted all across life. They talk to a few people, they don't talk to others. But if you find a person who's not introverted, becoming isolated, withdrawing, and getting into a shell, you need to be alerted. As much as you should be alerted about somebody violent, aggressive, who's visible, you need to be alerted about somebody isolated, not picking up the phone, not talking to his friend, not putting a WhatsApp message, not posting a Facebook message, not being available on his birthday, not greeting you on your birthday. Pick up the phone and talk. You need to encroach the space of the person and ask, how are you? We are not supposed to respect the space of people who are lonely and who are withdrawn. And that, I think, is very important. Withdrawal can be a sign of depression. Withdrawal can be a sign of early signs of stress, and which can lead to depression. Withdrawal can also be because of shame, because of loss of job, because of salary cut, because of loss of house, because of not being able to pay PMI. Please enter the house in your building if people are not coming down. Please call up your close relative who's not seeing. They are not arrogant. It's not about attitude. It could be about depression, shame, guilt, or fear.
That's really well said. A question for Dr. Chhabria. Shruti Prasad asks, can you please shed light on what is the difference between what makes a mental health professional? What is the training? What is the licensing? What is the ethics? And there's another question I want to combine with this, if I may. This one is from Bokisam, who, forgive me. A question from Kiran, who says, what are the standards for psychologists that I need to check? So is there a qualification? What should we be looking? How do we know the difference between someone who's properly qualified and a quack?
So, for example, a psychologist is someone, who has finished at least their basic education. So, if we are looking for a psychologist who is trained, then you're looking for someone who has completed their MA in psychology. Okay. And of course, if you're looking for people who are counselors, a person can do a basic course of counseling for 3 months. But I think, today, Faye, it's important that we need to reach out with whoever is available with a good heart, but also someone who has the right ethics in place and who is not promoting the myths of psychiatry. Okay, so we don't want people who have got a whole lot of followers who say that no, suicide is not real, it's okay, go out for a holiday or just sit and chant and you're going to be fine. We need people to understand that if you're feeling suicidal, there is a medical problem. So I know I've digressed a bit, but the degree is important. Along with that, also, what is important is that we need more people just than the degree, because the problem is too huge. We need our governments to be involved, we need the regular people to be involved, but before that we need to dispel the myths.
Yes. Dr. Shetty, I saw you shake your head. Is there something you disagree with?
No, I agree. But I agree with what when she said that you should not be just anybody. But the point is, the government has created a problem. Psychologists are supposed to be MPhil, and you don't have MPhil psychologists at all. And there are hardly any MPhil colleges. Number one, in the mental health care. Number two, which is very important, is there's only one default body for education, RCI. RCI is the Rehabilitation Council of India. But counseling psychologists, clinical psychologists need a separate licensing body like the MCI, the Medical Council of India, MCI, or the MMC in Maharashtra. So there's a lack of licensing bodies in the country for counseling psychologists, for clinical psychologists. That is the need of the hour. The Niti Aayog is now setting up a licensing body for the medical social workers. So I think that is number two. Number three is, as Anjali said, at least masters in psychology. And sorry, no tarot card, no angel accessing angels, okay, and no fingerprinting for a career test. Fingerprinting is sophisticated astrology. Please don't do DMIT. Go to a proper clinical psychologist for career guidance. So no tarot card, no past life, no angels are coming. Let's follow evidence-based science. But along with that, Faye, what is very important is the spiritual element of the person, when used along with the science, makes a lot of difference. But you need to have that balance, and that I think is important.
Kaneez, go ahead.
I just think, like when we want to heal ourselves, we can do it holistically. It doesn't have to be one or the other, but it's important to bring in both elements. Like, and no one's saying your beliefs are not true, but it's important to go the allopathy way. Like for me, at least, I think it's important to look at healing more holistically than just choosing one. You don't have to choose just one. You can.
Kaneez, do you think it's possible for you and I to partner up and work with Nelson and create a program where we get as many influencers certified as we can, or trained, or whatever we can do?
I would absolutely love that. I mean, even the 3 months didn't seem like, I know it's just a counseling qualification, but I think that, and there's a lot of us, there's a lot of comedians like Neville Shah or Daniel Fernandez, Rohan, myself, Tanmay. There's a whole bunch of us who talk about mental health issues constantly. Atul does a show. There's a lot of, I'm sorry, I'm obviously missing names, but I think there would be a whole bunch of comedians at least. I don't know what other influencers, but comedians who are definitely up for this. So I think, Nelson, if we could honestly do something together after this live.
I'd love to, yeah.
Yeah, for real.
So
and you could include us as well, Faye. You could include us as well, so we'll add the science element.
Yes, who don't know, Dr. Anjali Chhabria is Atul 1/2 is his sister, and she's doing a lot of work. I mean, she's so good looking, that's why it's difficult to believe. Don't
I'm so smart, so you just didn't put it together.
But go ahead, Doc, you said you wanted to be involved in this as well. What do you think?
Yeah, so what? Yeah.
Sorry,
what Dr. Shetty and me have also been doing is, helping these mental health soldiers, and this is also something that Atul and I have been doing. We go to colleges, we talk about suicide, we talk about how friends can help each other, how friends can rally around. So I think we would love to be a part of this. And yes, not to go against the faith healing part of it. But I think, Kaneez, what we need to do is we need to first understand the science, and then we can lace it up, with the other stuff, right? Because if you have malaria, only meditation will not help you. You need medication.
Absolutely. And this is what I was going to ask Dr. Shetty as well. Assume that someone in your family has a really bad hacking cough, and now you're worried it's either one of three things. It's either pneumonia or TB or something worse than that. Would you recommend a tarot card reader or a nice walk in the park or a holiday? Or would you go to the doctor as quickly as possible? And if the doctor says go for a nice holiday, then great, right? But you've checked that.
Absolutely.
Yes.
In mental health,
so
we have two words, Faye. One is strain of the mind and fracture of the mind. Strain will improve by love, affection, holiday, session with of yoga, etc. But when there's a fracture, you need both, and that I think is very
Yeah.
important.
Very well said. Nelson, I have a question for you. Tanvi D says, at the government level, how proactively are we jamming in for concrete solutions? There are NCRB data telling us that the crisis is alarming. Is it on the priority list?
It is not, because we don't spend enough on mental health. We have a paltry healthcare budget itself, I think, which is, as a percentage of GDP, is lower than even other developing countries. And from there, the mental health expenditure is 0.06%. So even the Mental Health Care Act, which 2017, the government has not provided funding to implement it. But we definitely need to look at a suicide prevention strategy and a policy. There has been talks that the government is looking at that, but that needs to be expedited. What is also important that meanwhile we don't wait for the government to do everything, and all of us have a role to play. I think mental health professionals, influencers, teachers, parents, students, and everything. But the government can bring about regulation and law. Post that, that's the stick, but the carrot has to be about reducing stigma, increasing awareness, making sure that the media starts to report responsibly. So right, there is the Werther effect, which is basically when media doesn't report responsibly, and that can create a suicide contagion. And there's also something called the Papageno effect, which is the exact opposite. So when Marilyn Monroe died, there was an increase in suicides. But when Kurt Cobain died, because they focused on promoting help-seeking behavior, suicides actually dropped. So you can have both. So social media, smartphones can have a detrimental effect. They can also have a very positive effect. So I think we need to focus on those things. We need to look at a multi-sectoral, multi-stakeholder approach, and everybody needs to get involved. And we need to drive in the point that suicide is preventable, and suicide prevention is everybody's business. And normalizing this conversation. I was talking to somebody who said that about a decade or two back, they had difficulty mentioning the word cancer because they thought if you said the word cancer, you would get cancer. So they would say the C word. And think about menstruation and periods. It was a taboo subject, but now you have movies like Padman and so on. Same with AIDS, right? So we can make a difference, and it will have to come with both a carrot and a stick approach. And we spoke about rural areas. So 37% of all suicides by women globally are by Indian women, and this is in 2016 data. This was 25% in 1990. China reduced, female suicides by 70%, and one of the ways it did, well, other than the suicide prevention strategy, which was by design, is also by accident, because the women moved from rural to urban areas, so there was an increase in financial independence, autonomy, and so on, and less access to lethal means. Simple things like, I think Dr. Lakshmi Vijaykumar from Sneha has been talking a lot about this, which is to say, decreasing the lethality in pesticides, which is one of the ways that in rural areas is a method to die by suicide. And Sri Lanka has proved that if you looked at pesticide control, that you can reduce suicides. There are many ways to do it.
Yes.
And we also have to look at suicide as not just a mental health issue, but it is intersectoral. There's gender, there's sexuality, there's caste, there's politics, there's economy. So speaking about daily wage laborers, so there is data to suggest that in the 2007 crisis, when there was an increase in suicide in countries like Greece, countries like Sweden actually were able to stabilize and even reduce suicides because they had a social and economic safety net. If you have those inbuilt and they start to kick in during crises like these, we just don't need a mental health related approach, but we need to have different approaches from different stakeholders, and that would help. And we need to understand the problem correctly, because we don't. We just know, first of all, why is the National Crime Records Bureau reporting data on suicides? It's no longer a crime to make an attempt by suicide. That needs to move to the Ministry of Health. We are saying suicide is a crime. The data is coming from the Crime Records Bureau. You need to switch. And that's one of the big things that we need to do. There are so many things that needs to be done, but I think, all of us, this conversation is going to move this forward and hopefully spur people to action.
Right. And I was having a conversation with Julio Ribeiro, former Mumbai police commissioner, who talked about the crime of abetment to suicide. And he said that needs to be re-looked at. It can't be looked at the way it's being looked at right now. It has to specifically be someone was in the room and forced this individual to commit suicide, or to die by suicide. That has to be it, because otherwise it becomes too loose and it becomes too scary, and the police can then bring whomsoever they please into the net of that questioning, and that is dangerous. And you can find that conversation on the YouTube channel as well. Please listen to it. He is a very, very respected Padma awardee, specific to do with policing, and something we should see. There's someone on the chat window who's basically saying, Faye D'Souza, your link to Mangalore is obvious. One can read between the lines. It's clear what narrative you're peddling. Azad Lakshman, my link to Mangalore is obvious because it is what we call my native place. I'm Mangalorean. The narrative I am peddling is two things. One, I like fish curry rice. Two, that if you have any sort of stress, reach out to the people around you. If you see someone around you that's going through stress, is getting a little quiet, is not eating on time, is not sleeping on time, is not answering your calls, doesn't want to meet, doesn't want to chat, then reach out to that person. Something might be wrong. If we brush it under the carpet, it might be too late. That's my narrative for today. And I want to just, there are a series of questions that are coming that sort of link to the same thing. So let me try and put all of it into one thing, right? In this lockdown, many people are trapped in homes with their family. Now I'm using the word trapped. I mean, some of us love our family and it's supportive and it's wonderful, and you have rooms in which you can get some space and get some privacy if you want. But many people in our country don't have that luxury. There used to be a time when we would compare us back in the 80s and 90s, we would compare ourselves, or we would be compared to all the kids in the street, right? What was that person's exam results and that person, that Sonia auntie's daughter and somebody else's. So effectively there were about 6 kids you could be compared to in the whole street, and your extended cousins. Now, given social media, you're being compared to the whole world. Your parents are in touch with their classmates from school, and they're comparing you to those children. And the pressure this puts on kids who are now graduating, answering exams, taking entrance tests, getting their results, losing jobs, not getting jobs after they graduate. The amount of pressure this puts on married, not married, of different sexual orientation, transgender. If you are not perfect in the eyes of society and you are now at home in a lockdown, the amount of pressure that is putting on young people is tremendous. And I want the panel to tell us what these young people should be doing. Dr. Shetty first. What should we be doing?
I think what Professor Ghosh said, something is very beautiful. Amit Ghosh from Mayo Clinic was there with us some days back. And he said, this is an era of innovation and sacrifice. So in a family, if you have a 19-year-old and a 50-year-old, a 19-year-old should know that he should not do something which can bring the infection to the 50-year-old, and the 50-year-old should know that he should sacrifice for the people who are at the age of 19 or 20. The second thing is innovation. I think this is not in our control. And when we have all of us inside the house, let's see if we can really do something new in this entire disaster. I told myself I have to learn something new. So I joined a CBT course from the Beck Institute, and I said learning helps me to improve my mind. That is for me. But each one of us, even if we are not very affluent, not very, do something very small so that you innovate in this entire disaster. And the third most important thing is, come what may, preserve your 1200 grams of brain. The mind is not made of iron and steel, it's made of neurons. Let us preserve that so that when things open up, our creativity continues. And if there's a light inside your brain, you're going to do something new. If there's darkness inside your mind, you're going to fall. So let us sacrifice for each other, let us innovate, and let's work together.
Dr. Shetty, I'm going to ask you to repeat one piece of advice that you've given in the past on my shows, which I personally find very useful. You said, go out and look at the sky.
Yeah, absolutely, absolutely. I tell all these boys who are young to just phone their friends and say that and ask their parents to buy grocery at the same time so that the boyfriends and girlfriends can meet in the market. And, and what is also very important is look at the sky, whatever color it is. It is illuminative, it is stimulating, and it is liberating. I think that I think is. I agree with you, Faye. How do you remember all these lines?
Let's say this.
Everything you tell me, I write down, by the way. I can see Dr. Chhabria has a guest speaker as well. Please go ahead.
Yes. Okay. So I think just reach out to whoever loves you, whoever cares for you. Forget about those who don't. Okay. And share whatever is on your mind. Just talk to them, tell them, I'm angry with my parents, I'm irritated, use whatever language you want to use. But just reach out to your friends. And once you finish talking to them, hear them out as well. So I think if we do that, and of course exercise, all
Yes.
of I think whoever is listening, please, whatever exercise you can do, whether it's in your one room kitchen, it's in your little 4x4 space, whether you need to dance, move, do something, because once you do that, you'll automatically start feeling better.
Yeah, and lockdown is not as hard as it is right now. You could put on a mask and just
Yeah.
go for a walk.
Go for
See
a
the
walk.
sky,
Yes.
get the checkbox, all of these things. See your friend at the end of the street. Kaneez, Hyperbole is also saying when you study marine biology, you end up working in a call center. It causes a lot of stress. A lot of people fear that their careers are failing. A lot of people are seeing their savings sort of deplete because you haven't worked for the last couple of months and you're just using your savings. You don't know what the rest of the year is going to look like. What's your advice for people going through this right now?
For me, just people are going through. I mean, it's a very tough period for everybody right now. I agree with what Dr. Shetty and Dr. Anjali said about just trying to get out of your head a little bit. Just try move your body, just get out of your head, because I know a big problem for me is just overthinking everything. And if there's possibilities for us to just get out of our head momentarily, we can maybe just see something from a different perspective. I feel like we're all seeing the same thing we're seeing everything from the same perspective right now. This is so random and so dumb, but I just want to let people know that there's this really random video that I watch from time to time. It's called The Powers of 10. It's on YouTube. It's a video from 1977. And it's just, it just zooms out into the universe and zooms into your blood cell. It just shows how it's a very therapeutic video that you can do right now. And it just makes you feel like there's something bigger out there and there's something even smaller and bigger than you. It'll just help you get out of your own head momentarily.
Tanvi D says, can you please share the link that Nelson had mentioned earlier? Nelson, go ahead.
Yeah, it's www.spif.in. Again, that's www.spif.in.
spif.in. Yes,
that's
and
right.
we put that in the description of this video as well, so you can get it later. Last question from Kiran for Dr. Shetty, very specifically. This is a little bit off topic. How reliable is CBT for ADHD and ADD, Dr. Shetty?
CBT is largely for depression, anxiety, OCD, and PTSD. But what is important is whoever has ADHD or whatever, see that you go to the psychiatrist and your psychologist, and if they decide that it's useful for that person, please go ahead and do it. So it's important that you do it only after a referral by a mental health professional, and that is, but it's very useful for depression.
So, if there's anyone who wants to add anything, we've overshot by 10 minutes. Yes, Dr. Shetty, go ahead.
September is a month for suicide prevention, 1 to the 30th. Please post on your Twitter, on your Facebook, on your Insta, wherever you are, whoever is listening to the show, positive messages for health, for family health, anything that you think you need to put to prevent suicide. Please put it in your own words. Don't worry, you'll not make a mistake. And follow all of us and we'll follow you. And so that we multiply the effect, because if we have to influence mental health policy, we have to have numbers. I think that is very, very important.
Absolutely. We're going to leave it there. Also, a response to those people who are writing about it, saying that if you talk about suicide, that more people will die of suicide, that you are encouraging it. That's not true. Like Nelson had talked about earlier, there are two ways to do this. One, what is happening on a lot of television channels, which is bad. Two, to actually read up about it, understand it, and be helpful. So encourage, apparently, if we encourage more and more people to seek help, even from a free helpline like the one that's currently running at the bottom of your screen, we will be able to prevent a lot of suicide. And that's the job. Prevention of suicide is the job. Dissecting it, gossiping about it, drinking your tea and wondering who's responsible for this, that's not the job. Prevention of suicide is the job. And it is our jobs because we have, without a shadow of doubt, someone in your social circle, someone in your family who's going through something. They haven't told you because you have not created a safe space. You have not created a space where they feel comfortable and they feel secure enough to talk about it. That's the job. Create a space in your workplace, in your home, in your social circle, where people can reach out to you because they feel that you are a stable person who will not judge them, who will be able to help them out. That's the role we should all be aspiring for. That's how we can save lives. What can be of more use to this world than to save lives? I want to thank my panelists for being so patient and for answering all of those questions. And I want to thank the audience. And if you found this helpful, we will do this as often as we can, especially in the month of September, so we can prevent suicide. Thank you for watching. Stay safe, get help. Good night.